afternoon. I'm Jess Kieran Johal with the Health Account Management Division, where we provide resources and support for the public agency and school employers that contract with CalPERS for health benefits, as well as the state of California and California State Universities. We also serve as the health benefits officer for all retirees enrolled in our program. I'm happy to speak with you today about this year's open enrollment.
Today, we'll cover key dates and the changes you can make during open enrollment. We'll walk through what's new for 2024, as well as member communications. We'll tell you where to find resources to guide you through open enrollment and how you can make changes to your coverage if you choose to do so, and then open it up to any questions you may have. You may have noticed that our website has been updated with the full listing of 2024 health plans and premiums. This information is found on the Retiree Plans and Rates page. Health plan statements were posted today, along with the health plan search tools available in MyCalPERS and on our website. This week, on Wednesday the 13th, the Member Health Open Enrollment video will air on our YouTube channel at 11 a.m. We encourage you to register to learn more in-depth information on what's changing for open enrollment and the resources available to you. You can find registration information on the member education webpage on the CalPERS website. You will have to register to view the video on YouTube. Registration will close at midnight on September 12th. We'll share a learner's workbook when the video airs so attendees can follow along. On September 15th, members can find a link to the Member Health Open Enrollment video on the Open Enrollment for Retirees webpage. Additionally, we've updated open enrollment resources on the Open Enrollment for Retirees webpage. These resources include the Open Enrollment newsletter, your guide to choosing a health plan, and updated health publications, which we'll talk more about later in the presentation. Finally, as a reminder, open enrollment begins September 18th and ends October 13th. Your new health plan will take effect January 1st, 2024. For state and CSU members, open enrollment for dental and vision is during the same time frame. All right, moving along to what you can do during open enrollment. Open enrollment is the one time a year you can make changes to your health benefits without a qualifying event. During this time, you can change your health plan, add eligible dependents, and remove dependents. Of course, you can remove a dependent at any time throughout the year, not just during open enrollment. You can make all of these changes online through your MyCalPERS account. By calling us or mailing in your request, eligible retirees can also newly enroll into health benefits during open enrollment. However, this can only be done by calling or mailing in your request. Okay, let's walk through the health plan changes coming for 2024. First up are Medicare changes. Anthem Blue Cross Medicare Preferred PPO will offer new supplemental benefits: personal emergency response system, devices, and in-home support services. United Healthcare Medicare Advantage Edge will be changing from $0 to a $50 copay for emergency room visits. Western Health Advantage MyCare Select will expand into Humboldt County. And Kaiser Permanente Senior Advantage Summit will expand into 8 out-of-state regions shown on this slide. Next, I'd like to highlight the basic plan exits for retirees who are not yet in Medicare. HealthNet SmartCare of California will no longer be a part of CalPERS health plan offerings. This is the result of an HMO solicitation we just completed. Those who will be impacted have an abundance of plans they can enroll into, as there is a 100% overlap between their provider medical group and hospitals network compared with other CalPERS plans. And Anthem Blue Cross Traditional will exit Glenn County. If the members enrolled in these two plans do not choose a new plan during open enrollment, we will automatically enroll them in a plan that's available in their area with the most overlap in network. So, members who live in Napa County will be enrolled in Western Health Advantage, and all other members will be transferred to Blue Shield Access Plus. And of course, we've communicated this to all affected members through our custom letters. Next, we have some expansions giving members more choices in their area. United Healthcare Signature Value Alliance will expand to the counties shown on the slide for public agency and school members. This plan is already available in these counties for state members. Then, Blue Shield Access Plus EPO will expand into Del Norte and San Benito counties. An EPO plan provides the same covered benefits as an HMO with the flexibility to visit any doctor or specialist within the plan's preferred network without a referral. EPOs also have reduced member cost sharing, such as lower deductibles, co-pays, and out-of-pocket maximums when compared to PPO plans. So it's often a more affordable alternative to a PPO. Lastly, United Healthcare Signature Value Harmony will expand into Santa Clara and Santa Cruz counties. Next, we have benefit design changes for our basic plans. Basic HMO plans with Optum RX pharmacy services will have a pharmacy mail order program with opt-out option guiding members to use home delivery for non-specialty maintenance medications. This will also be available for basic PPO plans. Additionally, PPO plans will offer a site of care lab services incentive, which will waive co-insurance when members use preferred lab providers for routine lab tests. For the basic PERS Gold and Platinum plans, the out-of-network deductible will increase from $1,000 to $2,500 and $500 to $2,000. The amount depends on party rate. These changes and additional information for next year can be found on the annual health plan changes webpage on our CalPERS website. For open enrollment, we proactively send emails and letters to members regarding changes that may significantly impact them. These communications also encourage members to shop and compare health plans in their area to see if they can save money by changing plans. We sent emails in late July to members impacted by the benefit design changes and those with new HMO and EPO plan options in their area. We emailed letters in August to members affected by a 9% or higher premium increase. These letters also included information on health plan expansions and exits as applicable. Let's talk about retiree resources. I'll provide an overview of resources and where to find them. A key resource we offer is our dedicated open enrollment for retirees webpage on the CalPERS website. This page has everything you need to prepare for open enrollment. Here, you'll find resources like open enrollment dates, the 2024 health benefit summary, which provides a general overview of benefits, co-pays, and service areas for each plan. By September 18th, a link to the Health and Wellness by Health Plan webpage will be available to view detailed information regarding wellness benefits offered by our health plans, and a checklist to help guide you through what to consider when shopping for a new health plan. We've also updated the Health Program Guide and Medicare Enrollment Guide. Both are available for you to download on our website. On the annual Health Plan Changes webpage, you'll find a summarized list of the 2024 changes by plan. Another key resource is the Retiree Plans and Rates webpage. Here, you can find a full listing of health plans and premiums for each region, as well as out-of-state and association plan premiums. You'll also find the 2024 state and CSU contribution amounts on this page. And each health plan summary of benefit and evidence of coverage documents will be available online by September 18th. Finally, the most valuable open enrollment resource for you is your MyCalPERS account. This is where you will see special messages that pertain just to you. For example, if you live in an area where new plans will be available and are also in a plan with a premium that will increase by 9% or more, you will see two special messages. One that indicates there are new plans available, and the other explaining that your current plan's premium will increase next year. MyCalPERS is also where you can access the Search Health Plans tool, which allows you to search for plans available in your area as well as your doctor. New to the tool this year is the ability to include medical groups and Medicare doctors in your search. We also display member satisfaction ratings for each plan to help inform your decision. You can then compare plans and see side-by-side differences in premiums and benefits. For those of you enrolled in basic and combination plans, you can also see your contribution amount to get a better idea of what your out-of-pocket premium would be. That concludes our webinar. While you type in your questions, I want to let you know that a recording of this webinar will be available on the CalPERS YouTube channel and emailed to attendees no later than September 18th. Finally, I want to encourage you to complete the survey that we'll send to you after the webinar. Your feedback is important to us and will help us plan for the next year. Give us a moment as we look at the questions coming in.
Okay, thank you, Jess Karen. Okay, it looks like we have one question so far. Has there been any agreement left on the termination of the contract between Salinas Valley Health in Monterey County and Anthem? Are Medicare Advantage beneficiaries affected? Salinas Valley Health website still includes Medicare Advantage beneficiaries as those who are affected. I'm going to have Rob Jarzambek come and provide an update on this.
Hi, good afternoon, everyone. Larry, hi, thanks for the question. So we know that there has not been an agreement reached between Salinas Valley and Anthem yet, but I do know that they continue to talk. And so the negotiations continue, which is a very good thing from our perspective. This is what we encourage any side that has a contract issue to just continue talking so an agreement can be reached. As far as the doctors, as far as the who is impacted by it, I believe that Medicare Advantage folks are impacted. Is that what you? Yeah. So I think that is correct that the Medicare Advantage folks are impacted by it. However, I think that I know that I think they are still receiving care. I haven't heard any issues of care being denied. But if any of you out there have heard that, then please let me know and I can follow with Anthem accordingly. That piece of it is just another encouraging sign that I think that they are on their way to reaching an agreement. It's just a matter of time for them to get there.
Rob, there's another question here that probably for you to answer. Can you describe what is done for the increased premium amount for Kaiser Senior Advantage?
I don't understand the question.
I think it's revolving what is causing
Kaiser's increase overall. Oh,
yeah, overall.
Sure. I'm sorry. Sure. So Kaiser had, as I believe you all probably know or very aware, that Kaiser had a large increase this year, and so this was something that we were able to work with them to get it more in line with our projections. We set our baseline rate, and thanks to doing that, we were able to see that their increase of over 15 or 16% initially was out of line of what we thought of what it should have been of under 10%. And so we're working, so this impacted both the basic side as well as the Medicare Advantage plan, so Kaiser Senior Advantage, which you're referencing. And so we're committed to working with them to ensure that they are working on their trend. Their trend was what was the most concerning and the biggest component of that, what caused the increase. And so we've committed to working each other. Kaiser knows they have work to do internally to bring their costs back in line with where they were and where they were in our book previously. So we're definitely committed to working them with both on the basic side and on the Medicare side, because it was impacting both groups of members in the same significant way.
How do you contact CalHR for vision and dental? So if you have questions regarding your enrollment for vision, that would actually be through VSP directly. And if it's for dental, if it's regarding your enrollment, we would handle the enrollment transactions, CalPERS would. If it's more regarding the contract with the dental carriers, then that would be through CalHR, and we could provide the contact information for CalHR. But so it depends on what the question is. If it's transaction based, then CalPERS handles the dental transactions. But if it's more on the contract base, then yes, that would go through CalHR. Does Kaiser cover Nevada County? There is, I believe, certain zip codes that Kaiser would cover. The way to find that out is to use our Search Health Plan tool, which went live today for the 2023 or 2024 plan year. So you would use that to determine if your zip code is available for Kaiser and all the different health plans. There are only 7 days left before open enrollment, and if there is no agreement by then, our affected members in Monterey may want to change plans. Also, we were previously told by CalPERS that MA beneficiaries were not affected, and that was a mistake. Sounds like that has changed back. What about those on traditional Medicare with Anthem supplement? Sounds like this is back to the question on Salinas Valley.
Right. So are aware of the definite timing. Larry's certainly aware of this isn't the best time for any provider negotiation issue as we go into open enrollment. I can try to clarify this. I know there's misunderstanding in the beginning about who was impacted, MA or MedSup. As long as the provider accepts Medicare, the MedSup, so traditional Medicare group, can continue to see those providers. However, since the doctors then there's another component of doctors on duty and the Salinas Clinic. Those do accept Medicare, and so the Medicare Advantage members can still go to those sites for service. I'll actually send a note out so this is all clarified a little bit better. I'm going through a lot of my notes here, and I want to make sure I have the right thing. So I'll work with the stakeholder relations team to send something out to this group in particular on who is impacted and is not impacted. I want to make sure I have the latest information.
Okay. Question back about Larry. You're welcome, Larry. What I meant was, what is the increased amount going for at Kaiser Senior Advantage?
So this is going to overall increase in their costs. And so it still gets at the same thing. So they had a very high trend when it came to setting their rates for 2024. So it impacted both basic and Medicare. And so this is something that we've committed to working to with them. Kaiser knows they have work to do to bring this number down, both on their basic side as well as on their Medicare side. But the two were very, very close in their increases because of this overall Kaiser's costs and the increases that they've experienced.
And I wanted to clarify one thing I said before, and I apologize. Kaiser is not available in Nevada County. So back to my previous statement, it's best to use the Search Health Plan tool to your specific zip code to see which health plans are available in your service area. And just a reminder, so a recording of this will be sent out to all attendees by September 18th. The premiums are all available on our Retirees Plans and Rates webpage now. And the 2024 Summary of Coverage and Evidence of Coverage documents will all be available by September 18th. There are a few that are already out there now, but the rest will be available by September 18th. A question, what changes can you make during open enrollment? Just to recap that, during open enrollment, you can make changes to your health plan. You can add eligible dependents, remove dependents, and cancel your existing CalPERS coverage, and then newly enroll if you don't currently have coverage through us. Question, how can I make changes during open enrollment? So you can make open enrollment changes through your My CalPERS account. and we have a guide that walks you through how to make those changes online. And then you can also provide those changes to us in writing by submitting your request, or you can call us to our contact center to make those changes over the phone as well.
And Larry, I'm sorry, I found my most updated information on the Salinas situation, and no Medicare members are impacted by it. So I'm sorry for the confusion there. No Medicare members are impacted.
MA included?
Yes, sorry. Yes.
So just as a reminder, we're holding this special meeting for you instead of us going out to your chapter meetings. So I encourage you to use the Q&A feature down at the bottom of your screen, at your Zoom screen, to ask any questions that you have of us. So the MyCalPERS accounts have all been updated with, like I said, the Search Health Plan tool for 2024. It has the zip codes updated. The guides have all been updated and they're available online as well. Those are the health benefit summaries, the health program guides, and the Medicare enrollment guide for the new year. So you can use those to help shop for the best health plan for you and your families. And we have a new quick tip video that was created this year that shows the benefits of an exclusive provider organization and what an EPO is. Larry has a question. For those who don't use PCs, how do they get rates and plans and make changes? As far as making changes, they can submit their request, a written request. They can fill out the form and mail those in, or they can call the contact center and provide their request verbally, and the contact center can take those requests as well. And then as far as the rates are concerned, the health plan statements has some, provides them the rates that they're currently in, I believe as well. And then another question, how close are you to Kaiser modification of increases? How close to the 918? If you know, please tell us. Thank you.
Did the notification, when were the notifications sent out?
Are you talking about the letters that, the letters that we sent out? Phyllis, if you can maybe provide a little clarity on the question that you're asking on the Kaiser notification of increases.
They could share when those went out, Yesenia?
The letters went out at the end of the last 2 weeks of August. Those have all been sent out to those that were impacted by a 9% or greater increase. So those letters have already gone out. And for health plan statements, for those that have elected to receive their health plan statement mailed, those are being mailed out today. And then for those that have elected to receive it electronically, they are available through their MyCalPERS account. Okay, so clarification on the Kaiser modification of increases. This refers to the overage that he is saying that is under review.
Yeah, so Phyllis, that'll be for future years. So the rates are set for 2024, and they were significantly higher than what we would expect, and was really surprising to us. However, they are the rates that Kaiser needs to charge to its members. So what we've committed to doing is working with them to reduce their trend for future years, so that we're not continuing to see such high increases moving forward. And so this is a lot of work that Kaiser needs to do themselves to try to figure out what is driving their cost increases, and then how that can be translated back to members. And so we're both CalPERS and Kaiser are going to work towards this, but it'll take a bit for them to kind of change that trend. But it is something that we have laid out as an expectation for them, so we can bring them towards the middle of our book as they were previously, to really reduce that ongoing and future medical trend. And
there was also a question about dental coverage and where that state employees can find that information on the different types of dental carriers, and that information is on CalHR's website, and we can also drop a link in our chat as well. No, this information is, this presentation, the question is this presentation in lieu of the information we usually receive by mail? No, all the information is still being mailed out. This was just an additional webinar that we are hosting to provide our stakeholders more information.
And it was also designed for the retiree groups to use to share with your groups when you have your chapter meetings. So this will be recorded and put online, and so you can refer back to it that way. If you guys want to use it at one of your chapter meetings or have something a little bit different to refer to other than the printed materials or what is sent out by mail.
Question, I noted that Kaiser has a medical university that doesn't charge their students. Are we absorbing that expense in our current increases?
I would not say, I would think we're absorbing the Kaiser increases, whether I'm sure it's, I wouldn't say it's a direct correlation between that. It was really about the cost of the services and the care that they provide. So if there's other things that Kaiser is doing, that's kind of beyond my knowledge for that. But I'm not really, I can't say that is related to the cost increase at all.
Webster's is the status of the CDA lawsuit with Delta Dental. We do not contract directly with Delta Dental, so we don't have any insight on what's going on with that lawsuit. Okay. Well, I want to thank everyone for coming and joining our webinar today. We will send out a recording once it's ready to all the registered participants. And again, thank you for joining us.
Yeah, thank you, everyone.